And welcome back to Daily Wrap. I'm Joe Concha with co-host Rick Unger, Heather Hansen, also with us. And as always, and new to the Wrap, I believe he played Eric Stratton, really, in the off-Broadway production of Animal House, attorney Adam Thompson. So today marks the 5-year anniversary of Obamacare. As you may recall, the president had lofty goals when he proposed the law back in 2009.
If you like the plan you have, you can keep it. If you like the doctor you have, you can keep your doctor too. The only change you'll see are falling costs as our reforms take hold. I've also made it very clear to Congress that we must develop a plan that doesn't add to our budget deficit. My budget included a historic down payment on reform, and will work with Congress to fully cover the costs through rigorous spending reductions and appropriate additional revenues. We'll eliminate waste, fraud, and abuse in our healthcare system, but we'll also take on key causes of rising costs, saving billions while providing better care to the American people.
Sounds pretty good, but the president, as we know, wasn't able to execute on some of those promises.
But for the average person, many of folks who don't have health insurance initially, they're going to have to make some choices, and they might end up having to switch doctors, in part because they're saving money. But that's true. If your employer suddenly decides, we think this network's going to give a better deal, we think this is going to help keep premiums lower, you've got to use this doctor as opposed to that one, or this hospital as opposed to that one.
Okay, so the fact that some of those guarantees were not met wounded Obamacare, but so did one of its architects. You know him as Jonathan Gruber, who was paid over $2 million taxpayer dollars to make sure the bill passed.
This bill was written in a tortured way to make sure CBO did not score the mandate as taxes. If CBO scored the mandate as taxes, the bill dies. Okay, so it's written to do that. In terms of risk-rated subsidies, if you had a law which said healthy people are going to pay in, it made explicit that healthy people pay in and sick people get money, it would not have passed. Okay, just like lack of transparency is a huge political advantage, and basically, call it the stupidity of the American voter or whatever. But basically, that was really, really critical to get anything to pass.
The stupidity of the American voter, that certainly resonated for a while. And while Americans seem to be warming up to Obamacare, public approval is still underwater. According to a new Kaiser health tracking poll conducted in March, nationally, 43% had an unfavorable view, while 41% approved. So let's welcome to the panel health policy expert Grace Marie Turner. She is president of the Galen Institute in Washington, D.C. Grace Marie, we're now 5 years later. America seems evenly divided on Obamacare. Are you surprised by this recent poll?
I'm not surprised. We've been doing a number of focus groups, and right and left, people are starting to feel the impact of this law personally. And it is not going to get any more popular. It's no more popular today than the day it passed. People are feeling the impact in their pocketbooks. They now know that they couldn't keep the coverage they had. They couldn't keep their doctor. They weren't saving $2,500 a year for a family. In fact, it's costing them $3,000 more on average. Their deductibles are sky high, so high, in fact, that many people say they're paying their premiums and they still can't afford to go see a doctor. Plus, this is costing us, the country, at least $1 trillion in new taxes, and it's cutting Medicare, $716 billion. Seniors are starting to feel the squeeze, particularly those on Medicare Advantage. The small business community is having incredible dislocations because of the employer mandate that forces them to cut hours to 30 hours a week for a full-time worker, or pay a huge fine. So there are so many ways in which the American people now know they were lied to get this bill passed. It was passed as a political agenda. It got everybody to the table, but the American people are now, 5 years later, feeling personally for themselves the detrimental impact of this law.
So, Grace Marie, it's Rick. So,
hi, Rick.
How are you? So tell us something good that's come from Obamacare. Can you pick anything that's happened that is a positive?
Well, there are people who who were having trouble getting health coverage before, people with pre-existing conditions, and now the insurance companies are required to cover them. But there are so many other ways
what
that we
about,
could have solved this problem without putting so much government bureaucracy.
What about the percentage of adults dropping to 12.9, the lowest percent of uninsured in this country since we started keeping records? What about the fact that the CBO says that it's played a major role in bringing down the annual deficit? How come nobody ever gives credit for those positive things?
The Medicaid, the way that this has expanded coverage, first of all, many of the people that are enrolled in the Obamacare exchanges were forced into those exchanges because their private plans were canceled because they did not comply with Obamacare.
Right.
The huge majority of the coverage expansion is through Medicaid.
Yeah.
Not every state has decided to expand Medicaid, but that is the worst health care program in the country, and we have expanded it to
Not
now
everybody would
covering
agree with that.
Grace, to follow
Medicaid.
Yeah.
Grace, to follow up on that point about Medicaid, I think 60% of the new enrollees are actually Medicaid enrollees. We know about the accessibility problems when it comes to Medicaid. Do you think that we've seen the extent of those problems yet, or do you think that's going to take a year, maybe two, before we see a real problem where we don't have the supply of doctors to do these visits and the demand has increased to such a degree that nobody can get in to see their doctor?
We're already seeing it. Hospital emergency rooms are overloaded with people who can't find a primary care physician to see them. We saw this in Massachusetts when they passed Romney Care, a precursor of Obamacare. There was a huge increase in number of people going to hospital emergency rooms. They had insurance, but they couldn't find a doctor to see them. We now know we have a physician shortage of somewhere between 60 and 100,000 physicians that we don't have because they're retiring early. We don't have the capacity in the system to train physicians. So we've done nothing to increase the supply of physicians and hospitals, and yet we're pouring so many more people into the system that it's going to do nothing but cause more waiting lines, as we see in European countries, and higher costs as you start to see the cost pressures, more money going to this system without doing anything to increase the supply.
Well, Grace Marie, we certainly thank you for joining us today from Washington, D.C., and I have a feeling we'll be talking about this more as the 2016 election comes more near, particularly if Hillary Clinton is the Democratic nominee. She obviously was in charge of a health care initiative under her husband back in 1993 that didn't go so well, so I have a feeling we'll be debating this more. Thank you so much for joining us. We appreciate it.
Thank you so much.
Coming up next, should fraternities be banned? We will discuss. This is the Daily Wrap, and it's only on Newsmax TV.